Hi everyone, I am Shafiq Khan and today I will talk about dengue fever. I had researched on level of awareness about dengue fever among medical students in Ayub Medical College. So I wanted to make a video on the dengue fever which can be used both for study purpose and as awareness. I will discuss the dengue fever under these headings. First of all, introduction, epidemiology, serotypes, then the clinical types and signs and symptoms of dengue fever, then a transmission and pathogenesis in the last diagnosis, prevention and treatment. Dengue fever is an infectious disease in tropical areas. It is most common arboviral infection in humans. Arboviral means that it is arthropod borne. And the history of symptoms can be traced back to Qin dynasty. Such symptoms also found in Qin dynasty era. It is caused by RNA virus called the dengue virus. Its genus is Flavi and family is Flaviviridae. Now the epidemiology. The mortality rate of dengue fever without treatment is 1 to 5% and with treatment the mortality rate is only 1%. Dengue fever is endemic in more than 110 countries including Pakistan and it infects 50 to 100 million people worldwide annually. And the death ratio due to dengue fever are 12,500 to 25,000. Dengue virus has 4 serotypes DNV1, 2, 3 and 4. On infection, the immunity can be developed against one serotype. It doesn't lead to immunity against another serotype. If a person has got infection with DNV1 serotype, so another time he can't get infected with DNV1 serotype, but he can get infection from other three serotypes DNV2, 3 and 4 serotypes. Now the clinical types. There are three types of dengue fever: classical dengue fever and also called Bragg-bone fever. Second one is dengue hemorrhagic fever and third one dengue shock syndrome. On first exposure, one usually get classical dengue fever. On second exposure with another serotype, a person usually get dengue hemorrhagic fever, with which either resolve or progress to dengue shock syndrome. Incubation period is the time between the exposure to the causative agent and the onset of symptoms. For dengue fever, it ranges from 3 to 14 days, but most often it occurs in 4 to 7 days. Now, signs and symptoms. 80% of infected people are asymptomatic or they may have mild fever. The signs and symptoms of dengue fever occur in three phases: febrile phase, critical phase, and recovery phase. But I describe these symptoms in a simple way. Patient usually develop sudden onset of flu-like symptoms, high fever up to 40 or 41 degrees centigrade, retroorbital pain, headache, myalgia, muscle pains, arthralgia means joints pain, maculopapular rash, cough and nausea and vomiting. Hemophagocytic lymphohistiocytosis is a serious condition rarely induced by the dengue infection, with high mortality and morbidity rates. There are two reservoirs of the dengue virus, humans and mosquito, and the jungle cycle reservoirs or the monkeys, and dengue virus is transmitted primarily by Aedes aegypti and it is also transmitted by Aedes albopictus by daytime biting. Aedes aegypti is a slightly bigger mosquito having white stripes on legs and thorax. It also transmits other infections like Zika fever, yellow fever. Aedes mosquito act as a vector and ingest infected blood from patients. And after 8 to 10 days, the mosquito become infective and can transfer the dengue virus to the healthy individuals in saliva. The mosquito remain infective for the lifelong. The temperature has important role in the transmission of the dengue virus by mosquito. Mosquito can't transmit serotype 2 virus at 26 degrees centigrade. Virus goes into the cell by endocytosis. Inside the pagosome there is reduced pH which allow the virus to undergo conformational changes and the glycoprotein with its fusion loop move freely. The glycoproteins form trimer with its fusion loop and then they attach to the cell membrane of the pagosome. The carboxyl terminal of the glycoprotein and the fusion loop expand its fusion and allow the viral genome to move toward the cytoplasm. It is hard to differentiate between the dengue fever and chikungunya. Both are the viral infections and carried by the same mosquito. Lab findings of the dengue fever are low WBC count, low platelet count, metabolic acidosis, and in severe cases there is a plasma leakage which leads to rise hematocrit and hypoalbuminemia, pleural effusion and ascites. There is rise in IgM titer and the virus can also be detected in the blood by using PCR technique. In last, I will talk about the prevention and treatment of the dengue fever. Now the prevention, according to the WHO, we can protect ourselves from dengue fever by reducing the source of vector and protecting ourselves from the bite of mosquito. For reducing the source of vector, we can use insecticides and empty the container of water. For protection ourselves from the bite, we can use wearing full clothes, mosquito netting, and mosquito repellents. For treatment of dengue infection, paracetamol is used for fever and discomfort, while NSAIDs are avoided as they might aggravate the risk of bleeding. Oral rehydration has to be improved. Blood transfusion is initiated early in patients presenting with unstable vital signs. Packed red blood cells or whole blood are recommended, while platelets and fresh frozen plasma are usually not recommended. Thanks for watching.